Hello, you're welcome to the teacher channel and to this presentation. So standard first aid and CPR course, a quick overview, and please you can subscribe if this is your first time visiting the channel, or if you have visited before but forgot to subscribe. This is a very good opportunity to do that. You can also give a thumbs up on the video if you have not set your notification bell, you have not turned it on. Please, you can do that now, and thank you for that. Let's see the agenda for the presentation. The agenda today: what is first aid and the objectives of first aid and CPR course objectives will be covered. Who can take first aid course? That is an important question that will be answered. The course content, what will be covered? I know many of you that have not taken this course before, or maybe you have taken this course a long time. You'll be wondering what could be the content will be covered, what will be covered, and that is what, or part of what will be presented here. Our training strategy is also an important component of the presentation, and of course many people will be eager to know more about the final exam that will happen after the training. The last activity will be the exam. What is first aid? First aid is an emergency care in response to illness or injury. So somebody who is ill, somebody who is injured, the first treatment, the first care given to that person is first aid. It is a basic care given to an ill or injured person before medical help arrives. So the basic care you give to an ill or injured person before medical help arrives belongs to first aid. Objectives of first aid to preserve life is: number one, to prevent injury or more injury. That is number two, and to promote recovery. So it is important to note the objectives of first aid. So when you provide first aid to somebody who is sick, ill, or injured, the objective is to preserve the person's life, to prevent injury or more injury, and to promote recovery. Objective of first aid course. So when you attend this course, what do you intend to benefit? What is the purpose of attending first aid and CPR course? Number one, to empower the participant, the student, the learners with the necessary skills needed to respond to emergencies. There are many emergencies, and each emergency may require a set of skills, and you need to know those skills, you need to master those skills, you need to be familiarized with the skills so that you know what to do, you know how to respond in the face of emergencies, to equip the participants with confidence. It is important to do things with the confidence. You need to be competent. What about awareness that will be created, knowledge that you're going to acquire, And in the end, your skills will be strengthened so that you will be effective in helping any emergency victim. So those are many objectives, part of what you stand to benefit by attending the course. And now the big question is, who can take this course? Who is this course designed for? Who is it designed for? And the answer is right there. Any person can take this course. Are you a parent? Are you a healthcare worker? Are you a non-healthcare worker? Are you, do you work in the community? Do you work in the hospital? Are you a teacher? Do you plan to be a teacher? Do you plan to work among children? Child care worker? Are you intending to go to college, to go to university? Or you even want to babysit your children or your sibling? This course is for you. It is for parents, it's for boys, for girls, young mothers, fathers, everybody, anybody can take this course, as long as that person wants to know how to provide the basic care to an ill or injured person. Then this course is for you. Then you can attend the course. So course content, the course will be based on the heart and stroke reference manual, and at the point of preparing this presentation, the edition being used is 2015. So that everything, most of what we're going to do, if not all, will be taken from this book. First aid course content. So if you have the book, you open that book, you look at the table of content, you are going to see these topics listed. And on the day of the training, you'll be presented with course agenda. You're also going to see that these are all represented on that piece of paper that will be given to you. So number one, emergency scene management, which will set the stage for what will be covered. This is like foundation of the building. Is the foundation of a building. It is a foundation of the course. So very important, of course, you know the importance of foundation. So this topic played the same role as foundation. Shock, fainting, and unconsciousness will be covered. Bleeding and wound care will be covered. Asthma and allergic reactions are also among the topics. Head, spinal, and pelvic injuries will be covered, and then we're going to also look at diabetic emergency, diabetes. We're going to look at that. Seizures, okay, is also part of the topic. Of course, you know, seizures are there are a lot of theories, a lot of speculations about the seizure. People have mystified the seizure. So part of what we're going to do in this course is to demystify it, to let you know why people have it, what is causing it, and how to respond when it happens. And then the big one will be chapter 8. Respiratory and cardiovascular emergency, and at the center of this particular topic will be CPR, AED, choking. Those are the important, some of the important things that will be covered. We're also going to talk about heart attack, cardiac arrest, angina, stroke, transient ischemic attack, TIA, and a whole lot of cardiovascular emergencies, high blood pressure, and many others. We're going to talk about, arteries and veins. So this is a big topic, very big indeed. Then burns will be looked into. There are 5 categories of burns. We're going to look at chemical burns, electrical burns, thermal burns, radiation burn, and inhalation burn. We're also going to see all the degrees of burn, what to do when this type of emergency happens to anybody. And child and infant CPR will be covered, including choking. So children CPR and choking as it relates to children and babies will be covered. Secondary survey, which is a quick, rapid assessment of the patient, focusing on non-life-threatening emergencies or injuries or conditions, and then bone, joint, and muscle injuries. Bone, talk about fractures. We're going to talk about dislocations. We're going to talk about the sprain and strain. And then one of the things we're going to discuss under this topic will be RICE, rice. So we're going to see how rice could be used during emergency concerning or around bone, joint, and muscle injuries. Poisoning will also be discussed. Poisoning will be discussed. Eye injuries, chest injuries will be part of what will be covered. Environmental related illnesses and injuries. So we're going to look at some of the emergencies that can come from the environment. Hypothermia, frostbite. We're also going to look at the heat cramp, heat exhaustion, heat stroke, and more importantly, what should be done in case any of these emergencies happen to anybody. How do we respond to them? Lift and carries will be covered, and this has to do with moving patient to another location if there is need to do that. So we're going to look at some of the techniques that may be used to move patients. So multiple casualty management, and this will cover skills and strategies used to manage a situation where more than one person is injured. A situation where 2 or more people are injured and require first aid. How do you go about handling that type of multiple casualty situation? That will be covered also under multiple casualty management. Our training strategies, our teaching is based on the principle of multiple intelligences, where different strategies are used to ensure that no participant is excluded or left out. This is very important because there are different categories of people that come for the training. Some of them may be university graduates, some of them may be postgraduate students, or even those who have graduated at a high level. Some may be high school students, some may be high school graduate. So you see that there are different layers of learners. So we are very careful to making sure that nobody is excluded, nobody is left out. So we have strategy that we use to accommodate everybody. We even customize our teaching techniques so that everybody will be accommodated, and so those techniques will be suitable for all the participants in the class. So this is why we're unique, and this is why we're the best. So the dominant teaching technique used in our classroom is discussion. So we engage in discussion. This is where we talk about application. How they apply the content, how they apply what is learned. It's not just talking and talking and talking. We need to bring it closer to real life situations. So discussion will be the best way to engage the audience, engage the classroom, engage everybody. We also show PowerPoint presentation. We have skill demonstrations, and practice are used. So skills will be demonstrated, and then the participant will follow and repeat those skills that will be demonstrated. Videos are used when and where necessary. So what are the expectations from the participants before the training? So before you come, before you attend the training, what are you expected to do? Get and read the course manual. Very important. Get that course manual, read it, start reading it before you attend the class. So bring writing materials with you. So arrange the writing materials and make sure that you bring them with you. Bring enough food, snacks and drinks. Sometimes people come to the training with nothing, and this is not an hour-long training. This is a long, about a total of 16 hours. 8 hours per day for those who are doing full course. So dress appropriately for practice. Watch as many videos from the teacher channel as possible. So watch as many videos as possible. This is very important. Watch as many videos from this channel as possible. We have many videos. The videos are very helpful. Please find the time, watch them. You are going to find them very useful. They will help you a lot in understanding what will be discussed during the training. During the training, what are you expected to do? When you arrive, please let your instructor know if you have any health condition that makes some activities difficult, like bending. Participate actively. I can't say this enough. Participation and active participation is very, very important. So I expect you to participate in everything we do. When we discuss, be involved. When we do the skills, please be involved. When we, try to ask questions, if you know the answer, you can also volunteer to answer, and then ask plenty of questions. Please ask plenty of questions. Take notes. Taking notes, very important. About the written exam, there will be a written exam at the end of the training. And of course, the exam will be drawn from all the chapters. Some chapters will volunteer more questions than others. So the exam will test your knowledge of the course content. It is a multiple choice question, about 50 questions in all, and pass mark is 76. So that is 38 out of 50. For those who are doing full course, please go through the practice questions on this channel. So we have some practice questions already designed to help you get an idea of how the final exam will look like. So please try and go through them. You'll find them very useful. We excitedly look forward to your attending our warm, lively, and enjoyable training. Our training is warm, our training is lively and enjoyable. So thank you again for watching. If you want to reach us, please send us email at theteacherchannel@gmail.com. And again, please, if you have not subscribed, you can do that now. Give a thumbs up, turn on your notification bell if you have not done so, and please share our videos. Thank you so much, and I expect you to be visiting our channel every now and again. Bye for now.